So the issue of health is one that concerns everybody. There's many dimensions to it, but one that has come to light recently is the issue of a thing called superbugs. Now, we've all heard what they are. We've heard that they exist, but how many of us know what they are, what causes them, and how they're controlled? Tonight, we're going to find out. So I have with me tonight Dr. James Ayukekong, epidemiologist, hailing from Cameroon, Africa, but now makes his home here in Canada. And Doctor, welcome to the show.
Thank you, Luis. It's my pleasure.
So let's just cut right to the chase here. And what are superbugs, Doctor?
Interesting question here. So superbugs are actually an informal designation given to bacteria that are resistant to antibiotics that are meant to treat them. So antibiotics were actually discovered about 19 years ago, in the year 2019-28. And this changed the way medicine was practiced. You know, doctors were able to treat infections that emanated from their practice. But recently, there's been the development of superbugs, like you said, and antimicrobial resistance. And this is compromising the abilities for doctors to treat infections and undermining the advances that have been made over the years in medicine.
Mm-hmm. So it's a big issue, obviously, and I heard, people are dying because of this. 8,000 Canadians, I've heard, are dying because of these superbugs, and I know there's overseas too, where you've done a lot of work. There's what causes these superbugs to arise anyway?
Because it's multifactorial. Like there are many things that could result or could cause the emergence of superbugs. The first is the unregulation of antimicrobials in some countries. Like in developing countries, you can actually buy antibiotic on the street.
Like some slides that kind of show that that's happening.
Yeah.
Where that can happen.
In Canada, it's quite regulated. You know, the antibiotics are quite restricted, and that's good. But in some developing countries, like we see in the image, you can actually buy an antibiotic in the street. And another thing that could promote the emergence of superbugs is the use and misuse of antibiotics. We are probably guilty for the fact that when we go to our doctor, they prescribe an antibiotic for 14 days. You know, after 7 days, we feel better, and then we abandon the rest of the course. So this has an effect because the bacteria develop resistance. And when we are sick, we cannot use the same antibiotics because the bacteria are resistant to the antibiotics because of misuse. And the next cause could be the misuse of antimicrobials in animal industries. In Canada, about 80% of antibiotics are used in animal production, right? So the misuse of antibiotics in animal production could lead to the development of selective pressure in the bacteria. And the bacteria develop resistance, and the animals are in turn infected by the resistant bacteria, and we get reinfected by eating the animals.
What's being done in the way of control, Doctor? I know there's a lot of work done. What's happening in that field?
Yeah. Like I said initially, it's a multifactorial and multi-sectorial problem. So a lot of stakeholders are involved in the problem of antimicrobial resistance. The first is regulation, right? For example, in Canada, we have the Health Canada that's regulating the use of antimicrobials, the approval and eventual use of antimicrobials in Canada. And the next thing could be the prudent use of antimicrobials. So people need to be informed about how they need to use the antibiotics. They need to adhere to doctors' prescriptions and things like that. And also there's a concept of antimicrobial stewardship, you know. What's the indication of the treatment we're trying to, the condition we're trying to treat? What is the duration of the antibiotics? What is the dose? What is the frequency? What's the duration? So all these things have to come into play for us to effectively use antimicrobials.
Mm-hmm. So it's obviously it's a big issue and it needs to be properly addressed. There's a lot of stakeholders. The pharmaceutical companies, they spend a lot of money to develop these antibiotics. We've got to use them wisely, obviously.
Yeah.
Right. So that's part of the deal. There's
a
whole lot of the doctors, the pharmaceutical companies, the regulators, the government regulations, the patients themselves. You know, we're all on board with that. Is that correct?
Yeah, exactly. Exactly, and at EpiTech, we are having we are pursuing a very specific direction, because we posted that if we don't get infections in the first place, we don't need antibiotics, right? So our intervention is infection prevention and control. You know, we help establishments like long-term care facilities and other healthcare establishments to build programs to prevent the transmission of infection within healthcare facilities.
Well, it sounds like your company's doing good. I got your T-shirt on here with the EpiTech's logo, and it sounds like you're really doing some important work to help that happen. And so we're out of time, Dr. Listen, thank you very much for joining us and informing us with important matters. Thank you very much.
Thank you.